It
Okay.
is.
Thank you so much, everyone. First of all, we would like to extend our heartfelt gratitude to the G4 Alliance African Working Group for the kind invitation. And as something we recently witnessed an interruption. And this is actually a very good message for us to begin with, that despite any resistance we face, we are always going to work harder towards our goal to achieve access for equitable surgical care worldwide and to work for global surgery. So nothing deters our determination and dedication for global surgery. On that note, I'm Dr. Pratyush Kumar, the co-chair of InciSion, alongside Sofia.
Hello, everyone. Thanks so much for having us here.
And today we are going to present our presentation titled Beyond Borders, InciSion's Impact on the Landscape of Global Surgery in Africa. Throughout this presentation, firstly, we would like to give you a broad overview about InciSion Global's work. InciSion is a global non-profit organization in special consultative status with the UN ECOSOC, uniting 5,000 plus students, trainees, and early career physicians and professionals working in global surgery. With a network of 51 plus national working groups, which is supported by an international team and led by an elected executive board. As you can see the collage, this is our international team for the tenure 2024. Our mission is to unite, develop, and mentor the future health professionals of the world involved in global surgery. And our vision is access to safe, timely, and affordable surgical healthcare for everyone, everywhere when needed. The couple of ways how we do it is, for example, our activities. For example, Global Surgery Day. This year we had the theme of Pandemic Accord. And we had a week entirely dedicated for Global Surgery Day, where activities, educational advocacy activities were conducted. We also partner with unique partners in various fields which is related to global surgery and also multidisciplinary partners. One such example is the Journal of Global Surgery itself. We also do side events and deliver statements at various platforms. Therefore, our work rests on three pillars, which is advocacy, education, and research. Now, I'll give you a broad overview of the global's work in each of these pillars. For example, in advocacy, we had a landmark course, which was the advocacy training for medical students, which had a series of webinars and workshops related to medical students' role in advocacy and how we can actually engage in it. At the same time, we conduct journal club, we conduct PR activities for promoting global surgery. At the same time, we also conduct side events related to WHO and other UN activities. Just a couple of, our participation in the United Nations events and World Health Assembly as a special consultative ECOSOC status. We do host side events. One of the side events we hosted this year was the ECOSOC Youth Forum side events, which was a 3-panel discussions related to surgical equity, breaking barriers to justice and ending poverty. Through these panels, we actually explored how achieving SDGs closely integrated to surgical equity in surgical healthcare. The second thing was the oral statement, which we delivered at the 57th United Nations Commission for Population and Development. Fortunately, I was there in person in New York, so I was able to deliver the statement on behalf of InciSion, where we urged the member states to prioritize investment in healthcare system to ensure affordability and accessibility of surgical care. The rest two photographs are from our delegation. The third one is from the this year's World Health Assembly's delegation. And the fourth one is from the UNCPD delegation. As you can see, members from all across the world are through our delegation program are able to, especially students and trainees, attend these events and participate in the side events and activities. On that note, I would also like to introduce the IPEL Fund, which we introduced this year. That is the InciSion Policy and Advocacy Leadership Fund. We recognize that for students, it's very not always feasible to go and attend these events because of all the financial logistics involved in this. Therefore, we came up with this idea of Policy and Advocacy Leadership Fund. It's a pioneering initiative which we did, dedicated to cultivating the next generation of leaders in global surgery, advocacy, and policy. As a civil society focused on health, InciSion is committed to young professionals and trainees. So through this fund, there are two key initiatives we are focusing on building, which is first is the delegation to major global health events, which includes the World Health Assembly, the United Nations General Assembly, Summit of Future, and the UNCSW and the CPD particularly. And the second is the youth-led global surgery side events. Through these funds, we are hoping to support multiple students and trainees from LMICs to actually be a part of our delegation without any financial constraints of their own. A couple of our educational initiatives is focused on how to do research projects or how to plan and advocate an activity. This is more focused towards capacity building of our national working groups on various parameters like financial sustainability of a national working group, how you have to build partnerships and collaborations. This also gives multiple life skills for a leader in healthcare around which it is focused to. A key initiative in education which we like to mention is the mentorship program which we came up with, which is a collaborative mentorship program of Incision with the International College of Surgeons US section and the Association of Academic Global Surgery AAGS. The photograph is from the 85th annual surgical update for ICS, where we attended the session and we presented about our mentorship panel. At this meeting, we also were able to, so the idea of this mentorship is that we are able to match the mentors from associations like ICS and AAGS, which are mostly faculties and senior professionals, with the mentee bank, with the mentee from our organization. So students, mentees from the Incision side and the mentors from their side. And thankfully, the two organizations were very supportive of us and building this mentorship program. It's built over three pillars of mentorship: research mentorship, mentorship for career development in global surgery, and mentorship for research, career development, and also leadership in global surgery. Talking about research initiatives, research is something which I've been very fond of because my journey in Incision began with a research, which was an Incision Research Proposal Program. An Incision Research Proposal Program, any trainee across the world is able to submit a research proposal, and the Incision team gives the support, necessary faculty guidance, and necessary everything basically which we need to conduct a research, which could be of a global level. I got introduced to Incision 4 years by that program itself. Other activities in research is conduction of multinational studies, conduction of journal club on our Twitter handle, and also research capacity building workshops as how to build a research poster and etc. Talking about this now, I'll hand over to my friend, Dr. Sofia Wagemaker, the co-chair of Incision.
Hi, everyone. So now I'll continue to talk. Thank you, Pratyush, for the amazing presentation. So now I'll talk about our national working groups in the African region. So first I want to introduce you. She's not present here, Dr. Mitra. She's the vice president of the national working group. So only in African region, we have 20 national working groups, as you can see here on the map. And these are the countries that we had the national working groups. So next. So we asked some of the chairs of the African region national working groups to send us a brief presentation or a brief speak about what they have done. And three of them sent to us some of the amazing opportunities and amazing projects that they did during the last year and the last year. So first is InciSioN's Ghana, Dr. Emmanuel Yeboah. So in 2022, InciSioN's Ghana successfully launched a research mentorship program that involves 10 webinar series running concurrent over a year with a mentorship arm where participants are matched to either a local or an international mentor to guide them through a research mentorship project to produce a published research manuscript. So during this research mentorship program, 40 participants were successfully matched to mentors and have begun working on their research. The successful story is one mentee presenting an abstract at the American Society of Clinical Oncology annual meeting in Chicago in 2023 and received the Concave Cancer Merit Award in 2023. Another meeting has submitted to a journal for publication, and the others are in different stages of their projects. Next slide. So these are some of the pictures about what InciSioN's Ghana has done. So they have the research mentorship in 2022, as I mentioned before. They also have a lot of online projects. So for example, they have this meeting in Zoom with Dr. Dominique Vermort. They have also meeting with Professor Afua Hessi, and they have also these webinars about publishing academic research, about how to be more connect with mentors and with research projects. So another national working group that we're very happy is the InciSion DRC. So the chair is Dr. Eben Ezergenda. InciSion DRC did a global surgery symposium in person that took place in the Democratic Republic of Congo, and over 250 participants, including healthcare professional, institution, faculties, members, students, and national and NGOs and health policy institutions. So during this symposium, we have participants from WHO, ICRC, and the G4 Alliance. So the symposium provides a platform to discuss challenges related to access to surgical care, advocacy for best practice, and promotes the implementation of the InciSioN's. So numerous recommendations were made to decision makers, and the concept of global surgery was discussed and understood by the attendants. These are some pictures from the in-person symposium that they have in DRC. So you can see it was with a lot of participants, and we have a very positive feedback. They also have some online projects, for example, the place of global surgery, and they are working a lot with in-person projects. So another one is the InciSion Cameroon with Dr. Ashanga Bill Smith. So they did a global surgery career mentorship webinar, which was organized in a 2-month duration. So the objective of this mentorship was to address confusion among medical students about how will be the future, what the career paths in medicine that they can join. So during this webinar, they provide guidance on pathways to specialties in the InciSion Global, for example, surgery, obstetrics, gynecology, and anesthesiology. So the outcome and the impact was over 200 participants from 10 medical schools in Cameroon. Positive feedback indication a sense of direction and purpose, multiple connections that they created between mentee and mentors, and they created a facilitation network. There are also some pictures from the mentorship program in InciSion Cameroon. It was an online program. We also asked some of the other national working groups in Africa to send us some pictures about their projects. So in the InciSion Burundi, we have the symposium online, the 30 symposium Chirurgia Global. And they also have the same symposium in person, as you can see in the picture, with a lot of participants, healthcares, and also we create a network between them. InciSion Rwanda have this obstetric and gynecology webinar that they did online by Zoom, and also had a lot of participants. We have InciSion Ethiopia with this online program in the International Global Surgery Day that celebrates every year in May 25. So this is one of the biggest projects from InciSion, the Global Surgery Day. So all of our national working groups worldwide, they celebrate it with us. InciSion Global also do some advocacy campaigns, webinars, and online projects. So all the national working groups, they join us during these campaigns, and they do their. InciSion Somalia also have the 30 Somalian Global Surgery Symposium that happened by Zoom, and the World Global Surgery Day that also is another national working group that celebrates with us. Next. So how to engage and how to connect with us. So you can connect by a national working group of your country, not only in Africa, but as Pratyush told before, we have a lot of national working groups worldwide. If in your own country don't have a national working groups, we encourage you to start a new national working group. So you can enter in contact with us by email. And you can also apply for our international team that opens every year on December, and you can join InciSion Global, not only your national working group. You can enter in contact with us by our website or by our emails. You can enter in contact with me and Pratyush by the Chair Global Surgery email. Or if you are interested to join a national working groups or to create a new national working groups, you can contact our VP National Working Group, that is Dr. Mitra, by the VP National Working Groups email. We also are on the social media, so Instagram, Twitter, LinkedIn, and Facebook. Thank you so much for this time. Thank you so much for having us. We are very happy to join the G4 Alliance group, and we are very happy to have all of you here. Thank you.
Thank you very much, Pratyush and Sofia. Thanks so much. that the technical hitches at the beginning did not, scare us at all. Thank you for such a presentation. I'm so excited about the presentation and extremely excited to see that the individual working groups in Africa are functioning very well with their pictures they've sent in. It gives us a sense of feeling about how large InciSiON is and how much we can advance some of our advocacy efforts through InciSiON because we are present in most of the countries. I see a lot of comments. I see our board chair, Gil, saying that she likes the IPA fund so much. So I'm sure from here you may want to reach out to her and speak more about it. And she's also asking AAGS to reach out to her because there are a lot of discussions we could have further. I also see Neil talking about his excitement seeing InciSiON doing a lot of work in DRC. Thank you very much for the presentation. I'm going to pause here and open up to participants for any questions or comments. Mohammed Sand is up. Mohammed, over to you.
Okay, thank you, Erin. Thank you, InciSiON team, for this great presentation. I'm just going to jump to the practical outcomes of these sessions. How do you think we can upscale our members' organization working in the areas of your members' working groups? Like, for example, if we have a working organization working in DRC and they have plans to do some projects that align with your working group at the moment, the practical approach for us as Africa Working Group to join those two efforts together, how do you think that we can go through this?
Absolutely. So, if Sophia, if you're okay, I can answer this question first, and then you can add to the points. Okay. Okay, great. So, thank you so much, Dr. Adam, for all your questions. So, yeah. So for engaging with a particular national working group, each national working group has their own individual email on our server, and you can find that the contact of the national working group through our website. But for ease, you can directly email to us and the VP National Working Group about any project which is coming up in any country, be it in the African region or outside, and we'll be very happy to connect you to the national working group of of that specific country. And based on the project, it depends. If you want to have a regional collaboration, for example, with multiple national working groups of the African region, you can directly reach out to us and we'll try to negotiate on how exactly we can, because for example, there are multiple times where there are initiatives which spans the entire African region. And, as InciSiON Global is already a member of the G4 Alliance, we'd be more than happy to support in any way which we can for enhancing your work in the region, any region. Thank you.
Yes, yes, very, very good. Very good.
Thank
Very
you.
good.
Can I
Thank you.
expand upon that question before we move on? This is Kathleen Casey. And thank you, Sofia and Pratyush. It was a gorgeous presentation. And the work that InciSiON does is just so impressive, and we have so much to learn from it. And just to kind of reinforce that point of how we, let me take off my camera for a sec, of how we engage. And it really should be more thoughtful and more systematic, probably, from a G4 perspective. And just so that you can remind everyone, it's fantastic. And obviously this is the African Working Group, but just to remind the larger group of how many working groups there are overall from InciSiON, so that we can always remind ourselves when we're working in a particular area of how many working groups there are, and that, we should always be connecting with the students and be aware of what work is already happening from an advocacy and education and research standpoint in a region that we can connect with. I mean, that's our whole raison d'etre, and we should not be, blind to the work that's already existing. So if you could just remind us of that, how many working groups there are around the world.
Yeah, absolutely. Thank you so much, Dr. Cassie. And firstly, I would like to really extend my gratitude for your presence here. Your presence means a lot to us. Dr. Cassie has been a long-standing pillar of support for InciSiON since its inception, and she has had our back like ever since I got introduced to InciSiON, or InciSiON has existed. So thank you so much, Dr. Cassie. About our structure for the national working group throughout, we have around 53 national working groups in different parts of the world. in the regions. Like we just showed the map from the African national the region. Apart from it, there are multiple national working groups which is also still in the process of enrollment, because we have a very rigid structure on how a national working group gets enrolled. So, and if there's already an existing national working group in a country, then again there are multiple, can we involve your country national working group? Okay, I also see a question in the chat box. So firstly, so that structure is there. I think the best way would be to reach out to the VP National Working Group or the chairs directly, and we'll figure out on how we can, connect you to a national working group on, to any region, or how we can actually have that relationship where national working groups can actively help and support the activities. And if there's anything Sofia would like to add to this, I will do that. Thank you so much.
I think no, I was just typing on the chat like our chair's personal email and the VP National Working Group email, so everyone, like we put on the presentation, but everyone can access. And as Pratyush told, is the best way to contact us and to join a national working group is contact me or Pratyush or the VP National Working Group.
Oh, thank you very
so
much for your response. We have our my co-chair NKOB's hand is up. NK, over to you.
Thank you, Chair. Great presentation. Thank you, InciSiON. Amazing work you're doing. I just want to take you back a little. If you could throw a little more light on your IPAL fund. It's really something very interesting. And it would be nice to have a little more information as what it entails. And so we know how to key in and leverage on it to see how we can expand the advocacy footprint in Africa.
Thank you so much, Dr. Obi.
Josh, you can share your screen again if you don't mind, and then
Sure.
we see that part again.
Okay, so let me just try, or I can just speak about it if it's fine, Dr.
All right. Okay, that's okay. That works for you.
Okay. So for the IPAL, as InciSiON has been sending delegations at multiple places in the recent years, something which we have always recognized is that for medical students as trainees, as a trainee myself, I can tell that how difficult it is to attend a conference in a different country, how to travel, that accommodation and those charges and everything is a very big thing. Secondly, there is the global surgery events, youth-led global surgery events, which we want to enhance at multiple places which have been happening. We have conducted virtual side events to the ECOSOC Youth Forum at other places, but we also want to enhance youth-led global surgery initiatives at the World Health Assembly and the UN events. From our experience at these conferences, we realized that we can come up with a way to support medical students and trainees. So we came up with the IPAL fund. It was released during the World Health Assembly this year itself, and an entire rigid application process with how medical trainees and students can apply into that fund and how much support can be given to them. It's information which we'll be releasing soon as per our timeline, as we wish to plan it accordingly so that we can release it when the next delegation for the WHO next year would be planning up. So in respect to that timeline, we'd be releasing a booklet and all the necessary details regarding this fund. Right now, we are more focused towards getting all that feedback in terms of and arranging things so that by the next WHO we'll have a structured thing which would be released and trainees could apply into it and get support from InciSiON to actually go and attend these events. So thank you. I hope I answered your question.
Right. NK, any follow-up questions? Yeah, she gives it thumbs up.
Sorry, just to add about what Pratyush told us. So during this year in the World Health Assembly, we also gave some pass for our members, so they could join the World Health Assembly, and they could join the committees, the meetings that they have that only people with pass could join. So this was a good time for them to experience this time in Geneva and see how the big leaders work.
All right. Thank you very much for your response. I don't see any hand up at the moment, but Gail is on the call. Okay, Kathleen's hand is up. Okay, Kathleen, over to you.
You can pose a question to Gail before my question. It's fine.
Not at all. It wasn't a specific question, but I was trying to invite her to share her opinion on the presentation and how she thinks the G4 Alliance can advance its advocacy efforts through InciSiON in our various countries. But that can be after you, Caitlin.
I have a specific question to the students about the African region and how G4 might be able to, what their thoughts are about the their ability to advocate for surgery, anesthesia, obstetrics and trauma within the region. Certainly their specific working groups within those 20 countries, there are avenues in place and just really impressive. I mean, those gatherings of 200 and more students and the impact that they're making are so impressive. But from, and I'm sure the message that they're able to make and the advocacy they're able to make on a national level is impactful. I'm wondering, and what we are doing many times is becoming regionalized. And I'm wondering about things like whether at COSEXA or at WACS or at PAX or at some of the more pan-African governmental gatherings for policy, whether or not G4 has a way to integrate the student message or vice versa, whether or not there's an avenue for that sort of collaboration. And maybe Gail could weigh in on that as well. So thoughts from both groups.
Right. Can we take response from InciSion first?
Oh, okay. So I think from InciSion perspective, we always start with connections between the national working group and with the organization. So sometimes we start with online, so online is more easy for us to connect. So I think the best way for us to do is like to connect especially specific countries in the Africa region with the G4 Alliance or with other organizations. Like we can make this bridge between them and they can start to create like small webinars. But some of the countries, they already have a great contact with the government. We have some specific national working groups in the African region that they have a good influence in the healthcare system. They have a good influence with health policies and people that work. So they already are having not only a powerful impact in the online webinars, but they are having powerful impact in their own society, in their own cities. So I think the best way, like the way that InciSion work that I'm seeing, like as past chair of InciSion Brazil and now chair of InciSion Global, is like we always start with small events, small webinars, and then we start to contact the healthcares and making it big.
Right. This is very well noted. I think all the discussions are around how InciSion can collaborate more with other G4 Alliance organizations within the countries where they function more. There is a comment in the chat box from Vicky. Vicky says that medical students are still at the very junior level with regards to what meetings to attend. The higher level meetings are usually available online. On another note, the individuals that are more senior have made decisions regarding their medical trajectory and would better benefit from meetings. She's asking, how are the more senior people being supported? Yeah, I don't know whether senior people, well, maybe Sophie, you can take this and tell us who are the members of InciSion and perhaps how you are supporting senior people in the field.
I can speak a little bit about for this question. So firstly, we always, as an organization of students and trainees, we have always, prioritized advocacy and prioritize giving a voice to young people and young students and trainees. But at the same time, since we came into existence, we have always been supported by senior people who have supported it at every ways and mentored us. So we share a very mentor-mentee relationship with them. At the same time, we also and when we started getting these passes, we also offered these passes to residents who were in senior level of training, who wanted to attend the World Health Assembly. And, they were, because a lot of students were not able to financially afford it, and there were residents who were traveling there and there. So as soon as we got the opportunity, we tried to give it back as much as we could as an organization of students and trainees, and give it as much as back for them people. So they did attended the World Health Assembly on our passes. So we always try to, give back to the community due to which we are standing here, and we are always grateful to all the mentors who have stood behind us, because of which we are into existence, and we are really grateful for them. And this is something we would definitely love to explore on how in future, we can also see on how we can work on these arenas to help people in a bilateral collaboration. Thank you.
Right. I see another comment saying coordinating of these groups is greatly needed, and the African Working Group in position to coordinate and communicate between groups. We have very well taken note of that, and we'll reach out through InciSion Global to the national level working groups. We have a lot more people in the call. The floor is open. We would like to take a comment from Gail. After Gail, we see Laura on the call. We'll take a comment from Laura, and then we move to Neil. We just want to hear you speak, the leadership of G4 Alliance.
I think she's off.
Oh, okay.
We have Bisola here as well. Neil
All
and
right.
yeah.
Yeah, hi
Yeah.
everyone. Sorry, I'm not
Hi, Laura.
prepared for a presentation or to be on camera even. I've got a lot going on in my house with appliances being installed. So I don't have a specific comment, except I think you all know I have a keen interest in supporting and collaborating with InciSion, and deep experience that continues, especially in West Africa and Francophone West Africa, and even the DRC. So I would encourage InciSion members, like I said, especially in the Francophone countries, if you have specific activities that you'd like G4 Alliance to participate in or to support, or if there's a list of point people I can be in touch with as I continue to travel to a lot of the countries that were shared, were talked about in the presentation today. So again, just thank you for all of your efforts, and happy to stay in touch. I currently have projects I'm supporting in, let's see, Cameroon, Benin, Burkina Faso, Senegal. I would say those are existing projects. Also, sorry, in northern Nigeria, especially in Kano, Nigeria. So again, happy to be in touch and have follow-up conversations about any of these countries. And thank you all for your energy and really passion around this work. Very impressive. Thanks.
Thanks so much, Laura. Neil, the floor is yours.
Yeah, look, I just want to encourage you and thank you for your efforts and for your presentations today, which I put in the chat were fantastic. For those of you that the InciSion people that don't know, I'm an Australian, but I'm usually based in the Democratic Republic of Congo. So I'm well aware of what InciSion's doing there, and my colleagues have come through the InciSion. The classic example is Dr. Bake, who's now one of my surgical colleagues, who's come through InciSion as a medical student, worked through as a trainee, and then developed, 2 years ago was awarded his fellowship through COSEXA, and is doing a fantastic job. I just use that as an example of encouragement to you that yes, it's about networking, and yes, it's about advocacy at higher level meetings, but it's also about using the opportunities to network together in your own regions and to move through surgical training at whatever level you end up deciding to do. So I just wanted to encourage you about that. It was my pleasure to speak, albeit virtually, to that DRC InciSion conference a few weeks ago. There were a few technical hiccups, but I think we got through it. So I just wanted to encourage you from a DRC perspective. As you probably realize, it's not the easiest country, and to have such a committed group in that country working together, supported by the international InciSion leadership, that to me is really exciting. So just to keep encouraging you, I've met some of you at different meetings, and I look forward to having further integration with you. Basol is the current president of the Permanent Council of the G4 Alliance. I'm the president-elect and will become president in November, so I look forward to continuing to work with InciSion.
Right. Thank you very much, Neil. We also see on the call Pedro from WFSA. We'll be excited if you have a few comments for us.
Not at this time. I see the enthusiasm of these young colleagues, which I think we should definitely support.
Thank you very much, Pedro. We'll take a comment from Ruben, and then we'll move on to Bisola to conclude for us to close. So Ruben, would like to hear your thoughts.
I would just say our desire to work closely with you is and has always been there. Our view of the future will not materialize if we don't work with you. We are eager, excited, hungry to look for opportunities to coordinate better. You know, in the day-to-day, sometimes we're all going a million miles an hour. You have a group that's doing some impressive work. Members of PC, Permanent Council of the G4 are doing, you know, work through their organizations. Also, G4 itself as a coalition is doing some work. So don't be disincentivized by the usual madness of our everyday work. Show up to the PC meetings, show up to the working groups, and if we're faltering, point that out, because we will be the first ones to acknowledge whether we have really given you the support that you deserve. But we congratulate you and we look forward to working more with you.
Thank you very much. Before Bisola takes over to help us close, I'd also like to thank you very much for joining and also bring to your attention that the G4 Alliance is currently in discussions with Tanzania through Dr. Uthman, who was at the Permanent Council meeting in Geneva in May. We are really working closely with Dr. Uthman so that the G4 Alliance signs an MOU with the Tanzanian Ministry of Health. When this happens, this is going to be like a case study for us. We are going to try as the G4 Alliance to get all our member organizations in Tanzania to actually work together, not in silos, and collaborate our efforts so that we see how we can advance surgery, obstetric trauma and anesthesia care, advocacy and activities with a united front in Tanzania. We'll keep you updated as and when these discussions progress. I'll hand over to our President Bisola for your thoughts and also to help us bring this meeting to an end.
Well, hi, everyone. I came a little bit late, but I see that discussions have gone on and we see your interest, your passion. I can feel the passion. I can feel the interest, and congratulations on this presentation and sharing with a bigger body, the African Working Group. I just want to echo that to be relevant globally, you have to be active locally and relevant locally. And I always tell people you can't be Miss World without representing your nation. You can't go ahead. So let's be strategic, know the SOTA people in your institution, work with them, communicate with them, and carry them along so that when you move from local to national to global, we're all going to work together. Because when you do such a fantastic work globally, the bottlenecks will come up in the local areas. So let's network, let's get to know our lecturers, our colleagues, our friends. And at the end of the day, even when we get to the World Health Assembly, we will be sent back to where we're coming from. And if we don't have the network there, it's going to be really very difficult. So that's just one strategy that I want us to keep in mind. No matter how influential and effective we are,
in the global space, we have to go back to the roots. So thank you very much for this presentation. And it's really amazing that you have InciSion in, working group in so many countries. Have been part of InciSion, coming to your meetings in Uganda, and other meetings. So I'm really excited to be part of this, and I'm happy to be able to nurture medical students and work with them along this journey. It's a very long journey. It's a long journey. So let's get prepared. Thank you very much.
Thank you very much, Dr. Bisola. I see a very important comment with Natalie asking that we can work together in InciSion with all of you to coordinate our ECOSOC engagements, both in UNOC and in Geneva, and even also at the local level. I'd like to thank you all for joining. We are closing now. Thank you, Dr. Pratyush and Sofia, for your time. We really appreciate your presentation and the time you've shared with us. Usually when we close, we have a few more people staying on and having conversations. It's okay if you want to stay on and talk for a while. I would have to jump on to another call real quickly. Thank you all for joining. Miles, Elav, I see you all, Cassandra. Thank you all for joining. Thank you all for joining. We really, really appreciate your time. Stellam, I see you as well. Thank you all for joining. We look forward to seeing you on our next call. Enjoy the rest of the day.
Thank you.
Thank you.
Thank you.
Thank you, Irene. Bye-bye.
Bye.
Thank you. Bye.
Irene.